Integrating cultural competence into health assessments has been shown to yield significant and measurable benefits across various domains. It enhances data quality and accuracy, ensuring that assessment data is more complete, reliable, and valid, which is critical for effective decision-making. Additionally, it fosters community trust and participation, leading to increased engagement, higher satisfaction, and reduced mistrust among diverse populations. By addressing cultural and systemic barriers, cultural competence helps reduce health disparities, improving equity in access and outcomes for marginalized groups. Furthermore, culturally tailored interventions demonstrate greater effectiveness, resulting in improved clinical and behavioral outcomes and higher adherence rates. From an economic perspective, these approaches can lead to cost savings through more efficient resource use and reduced disparities in healthcare utilization. Finally, cultural competence benefits the healthcare workforce by enhancing provider knowledge, reducing bias, and improving decision-making, ultimately leading to better care delivery. These outcomes highlight the critical role of cultural competence in advancing equity and effectiveness in health assessments. Various frameworks and strategies for integrating cultural competence into health assessments offer unique approaches, strengths, and challenges. Cultural competence focuses on acquiring knowledge and skills about different cultures through structured training and checklists. However, it risks essentialism and tokenism if not applied thoughtfully. Cultural humility, on the other hand, emphasizes lifelong learning, reflexivity, and power sharing, promoting partnership and process-oriented care, though it requires ongoing commitment from practitioners. Culturally responsive care prioritizes adaptation and community partnerships, offering flexibility and co-design solutions, but is often resource-intensive to implement. Structural competency shifts the focus to systemic and upstream determinants of health, addressing root causes of inequities, but its effectiveness may depend on broader policy-level changes. Similarly, anti-oppressive practice centers marginalized voices and focuses on equity and social justice. Yet it can be difficult to implement at an institutional-level community-based participatory research. CBPR builds empowerment and relevance through meaningful community partnerships, though it is time-intensive and requires trust building. Cultural brokers serve as insider facilitators who improve trust and communication, but ensuring their training and sustainability can be challenging. Finally, adapted tools and interpreters improve the accuracy and inclusivity of assessments through language and cultural adaptation, though they may incur significant costs and logistical complexities. Each model or strategy brings valuable contributions to fostering equity and inclusivity, but their successful implementation often depends on balancing their strengths against practical limitations. Advancing equity in health assessments requires moving beyond checklists and static knowledge to embrace cultural humility, intersectionality, and structural change through evidence-based frameworks and genuine community partnerships. Research and real-world case studies show that these approaches lead to better data, increased trust, reduced disparities, and more effective interventions. Achieving this involves prioritizing equity by addressing both individual and systemic determinants of health, implementing evidence-based strategies such as class standards, CBPR, and culturally adapted tools, and learning from successful community-led culturally responsive assessments. To sustain meaningful change, institutions must invest in diversity, training, and policy integration. The path forward is clear. Health assessments must be culturally attuned, structurally informed, and co-created with the communities they aim to serve to ensure health equity and lasting impact.